Okay. I see many cases of spinal stenosis. Spinal stenosis is a very common condition as a spine surgeon we deal with. And I remember one case specifically. He was about 55-year-old gentleman. He was working, and what he's noticed was that over a period of about 18 months or so, his legs were getting weaker. And he's finding that he was getting, when he was walking, his legs felt numb and they were a bit wobbly, had pins and needles and tingling down his legs. And they're all features associated with spinal stenosis. And as the months progressed, his walking distance was getting less and less. Okay, and then eventually he was only able to walk 50, 100 yards or so. And then he came to my clinic. I saw him in my clinic. I examined him and I requested some MRI scans of his back. And what this shows, he had significant spinal stenosis in his spine. Okay, what stands out in this one here is that the most spinal stenosis occurs in the lumbar spine region. Anyway, this one was just slightly higher up in the lower thoracic spine, and what that was happening was giving him spinal cord compression as well. Okay, so I had a chat with him and his wife in clinic, explained the options of what they were, and in this case here, physical therapy wasn't really an option because the spinal cord was being squashed and damaged here. Any excessive movement might make that worse. Okay, and so the options, we either leave it as it is, or we consider surgery. Leaving it as it is wasn't really an option because we know this now for the past 18 months, he's getting worse and worse and worse. A 55-year-old man should be able to walk a fair distance without any problems, and this wasn't happening. Okay, so the next stage was consider surgery. Okay, and what I chatted with the patient and his wife, explained the risks associated with surgery and the benefits, and they opted for surgery. Okay, so I performed the surgery about a couple of years ago, and the surgery was successful, and immediately he had significant improvement in his legs, and he got back to work after about 6 weeks or so, and he's back to work now full time in his job, and I can still get a bit of contact with him, saying how well he's doing, and he's doing pretty good there. Yeah, and from initially when we diagnose a patient, a lot of people think a scan is the way to do it. Okay, scan is part of the diagnostic process, but what we do is we take a clear history and an examination of the patient. Okay, and what we listen to the patient and we understand what they say. And when this gentleman was complaining of pins and needles and numbness and heaviness in his legs, and his walking distance reduced, in that kind of age group, we're thinking of spinal stenosis. Okay, so with the diagnosis pretty much made usually from a clinical history, and then also on examination, there will be some features on clinical examination. Okay, we examine the spine and the hips and the neurology to make an assessment of what exactly is happening. Fortunately, in this gentleman's case, his neurology was normal. He had good power in his legs, but that's not always the case in some people. And then we made the clinical diagnosis. Then we get the appropriate scan to be done, and the scan guides and helps us in the diagnosis. The diagnosis is usually made clinically rather than with a scan. Scan confirms which level is the problem there. Okay, in most people with spinal conditions that come to see us, only a minority require surgery. Okay, and we see numerous people. Okay, and it ranges from like back pain and sciatica and other spinal conditions. But again, the good news is the majority of people don't require spinal surgery. Okay, and in this case here, what I mentioned, when the gentleman has spinal cord compression, and it's affecting mobility, we look at the normal options, which weren't really viable. And in this case here, the treatment plan would have been a surgical solution here. But again, a lot of people with spinal stenosis, depending on what the spinal stenosis is, they don't require surgery. Often, like physical therapy, anti-inflammatory medication, pain medication can often settle that, and then they get back to like a normal level. We see that quite often. The key is not to rush into surgery in a lot of cases there. Yeah, the patient was delighted with the surgery. Okay, he went home after about 2 days after surgery. He had inpatient physiotherapy and an assessment, and he passed all the tests of physiotherapy, and he went home. We made sure the wound was dry. There was no wound complication there at all. The scar healed nicely, and then by about 6 weeks or so, he was pretty much back to work. Okay, and each week as progressed, the leg got stronger and stronger. He could walk further and further, and less back pain and less neurological symptoms there. And over a 6-week period, he did pretty well, and delighted with the result. And the main thing is he's back to work now. He's contributing to society. He's earning. He's looking after his family, and paying taxes, etc. Yeah, I said before, the case. The interesting thing about this is that most spinal stenosis occurs in the lumbar spine. It could be between L1 and S1 vertebrae. Okay, in those 5 levels. The majority of spinal stenosis is usually L4-5 and L5-S1 and L3-4. But what stood out in this case particularly is that this was slightly higher up in the lower thoracic spine, where the spinal cord was being squashed there. Okay, and then when the spinal cord is being squashed, the more it gets squashed, the more function you lose as time progresses, and once you lose that function when the spinal cord is squashed, it can be irreversible. So therefore, when the diagnosis was made quite soon, we had to act quite quickly on that to get to decompress the spinal cord to allow the spinal cord to breathe effectively.